Can you hear me? Good morning. Good morning. Okay, so can we get our phones? We have a selfie moment and we do hashtag. Can we get our phones? We do a hashtag. Selfie. If you don't have a phone, you can sit next to your neighbor. Okay, at a count of 3. 1, 2, 3. Selfie, let's go. Bakopala na mushalila. Bakopala. I'm waiting to see a hashtag from the high table. Okay. So you can post on your Facebook, you can go on ZYP page and hashtag where you are, hashtag what you've got from the goals, objective, hashtag tag your friends. You can go live, tell them to come to the ZYP page. They can come on Zoom. We all follow together. Okay, so we'll be going ahead with the remarks. And the first guest this morning to give us the remarks will be the Provincial HIV/AIDS Coordinator Advisor for Lusaka, Mrs. Eunice Mercy. Ma'am, you are welcome. Can we put our hands together for her?
Good morning, everyone. I would like to first recognize the UNAIDS Country Director, Dr. Tasisi Barihuta. I would also like to recognize UNESCO representative, Roy Mukonka. I would also like to recognize the representative from Havos, Nana Zulu. I would also like to recognize the Director General for National AIDS Council, who will be participating via Zoom, Dr. Connie Osborne. I would also like to recognize the Provincial Health Director, who is going to be representing the Minister of Health, Dr. Kosit Mwale. I also would like to recognize the ZYP chairperson, Sibu Malambo. And I also want to recognize the presence of all the adolescents here and all the representatives from our partners in Lusaka, as well as those that are coming from outside Lusaka. I've been told that we have all the provinces here, the 10 provinces, and the adolescents are representing all the 10 provinces. So I would like to recognize you in a special way. You can clap for yourselves. Yeah, it is my honor and privilege to actually come and welcome you all, and also recognizing that the National Strategic Framework of 2020-2021 is actually taking care of adolescents, because you are a key population And we recognize that we need to make sure that the strategies that are being carried out as you carry out activities are actually being implemented, and you are the focal point persons for the programs that are in the strategic plan. We also, as under Ministry of Health, we have the Adolescent Health Strategy, uh, which is one of our guiding documents in which adolescents are able to implement activities in Zambia. So we place you adolescents as very important and key people to the prevention of HIV in Zambia. And you know that among the adolescents, the results, actually we should say the result-based information that we have, as well as the evidence that we have now, it's showing that adolescents are actually having, they are at the high rate of HIV infections. And so we are saying that we need to reduce the infections among the adolescents. And so you are very key to the programs in Zambia. So I would like to welcome you all to Lusaka as you deliberate on all the key strategies that you are going to do from today until the end of the workshop. Thank you very much.
Thank you, ma'am. We can do better than that. We can do better than that. Okay. Right away, we'll go into entertainment, drama. Okay. Okay, let's put our hands together for the entertainment.
Como chikulu kiliro chepe
Thank you so much. Thank you so much. Right away, we'll go into the remarks. Before we do that, please, the people behind and those sitting on the tables, we need to remember social distance. A meter, please. 1 meter apart. 1 meter apart. Those that are sitting behind can please move behind. You can move your chairs. Social distance. Social distance. I can't see people moving behind. I can't see people moving behind. 1 meter, please. 1 meter. Okay, thank you so much. Allow me to do the protocols this morning. The ZYP National Coordinator, Mr. Malambo Sivu. HIVO's Director, Representative, Mr. Zulu. Zulu? Miss Nana Zulu. USAID Dr. Barry Hatu. UNAIDS. UNAIDS, National AIDS Council, the Director General, the ZYP Board Chairperson, the Minister's Representative, Dr. Mwale, and the partners that are joining us via Zoom and others on Facebook, the young people from all the provinces, the 10 provinces of Zambia, and our fellow young people coming from our neighboring countries. I believe we have young people from South Africa, Zimbabwe. Anyone from Zimbabwe? Kenya, Tanzania. Okay, we have Kenya here, Tanzania, Botswana, Namibia. Any other country that have left, please, you can raise your hand. Okay, what country? Oh, what? We have one from the US. Thank you for coming. You are welcome to Zambia. You are welcome to this beautiful place. We say, Mwaiseni Mukwai. Help me, Nyanja. Mwaiseni Mukwai, that's Bemba. My own language, Tonga, I don't even know. Mwabonwa. Mwabonwa, Nyanja. Mwalandilila, Lozi. 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 Lwamwenzi. Mwamwenzu. In Tumbuka. Tumbuka, any Tumbuka here. You are welcome to Zambia. And we'll go straight into the remarks from our director, Mr. Malambo, who's going to officially welcome everyone and call upon the next speaker, Mr. Malambo. Over to you, sir.
Good morning. So welcome to the Regional Adolescent Health Indaba. On behalf of ZYP, I welcome you all. Thank you so much for coming. I would like to recognize the presence of the following individuals in the room today. First and foremost, correcting the narrative. I'm not the board chair. My board chair is seated right there. I'm just the executive director. Okay, so I recognize my board chair, Reverend Oscar Nyaiwa, UNAIDS Country Director, Dr. Barry Huta. I would like to recognize the representative of the minister this morning. Of course, UNESCO. I also want to recognize those that are joining us online. PEPFA, National Country Coordinator. Of course, HIVOS, our major partners and sponsors for this particular event. Thank you so much. We appreciate the support. It wouldn't have been possible without their support. Most importantly, I would like to recognize also the young people that have come from all over the country. Of course, my colleagues and comrades that gathered the courage to come all the way here with the difficulties of traveling these days. You get the COVID test that is uncomfortable. The procedure, also the process of getting it is another thing. The airports and the transiting all the way up to here is not an easy thing. So I appreciate that, comrades. Thank you so much. We remain indebted to you and to support, continued support. So this morning, I also want to say thank you so much to all our other partners, our technical partners, who have willingly accepted to contribute to this engagement. Most of them will be joining us online, virtually, from their countries of residence, and they will be sharing from there. We have the SADC Secretariat, who are also joining us and will be sharing a piece. We also have partners for, such as INASO from Tanzania. They're making a couple of presentations to try and help build capacity among the young people. I think for a long time now, the issue has been young people do not have the capacity to do certain things, and they continue remaining behind. Basically, the reason for gathering here, I think for those of you that have been members of ZYP, have been following what we're doing, this is a gathering that we've been doing every year since 2018. It's been taking different shape every year, but I think we've continued to engage because we want to believe that young people are vibrant, they're energetic, they're innovative, and we think that they can be able to design their own solutions to the challenges that they face. Fact is, solutions designed by young people are much easier to implement because you don't need anyone to come and teach you or mentor you or coach you to implement that particular solution. You can implement it on your own. Because you can do that, they become also cheaper because there's no middleman being paid to actually help you do what you're supposed to be doing right. Thirdly, they are also sustainable because they can outlive any funding mechanism. Like most of the funding we get is attached to timelines. So beyond the timeline, young people remain stranded if at all the solution was dependent on a mentor or on somebody to hold their hand throughout the process because they don't even understand what they're supposed to be doing. So we think that gatherings like this or platforms that allow young people to speak to their challenges and actually agree on what they think will be best responsive to what the challenges they're facing are better suited to address the challenges they face today. Moving away from boardroom arrangements where people will discuss and decide what works for young people and come back to employ another person to go and teach the same young person to implement the solution. We think it's not sustainable and it's leaving young people stranded every time a funding mechanism comes to a stop because there's no funding mechanism in this world currently that lasts forever. Even our governments struggle sometimes. There are certain programs that come in and they end. A good example are youth-friendly corners or youth-friendly spaces that have been around for quite some time. But they're mainly active, very active and vibrant when there's an outside partner, an external partner actually supporting the young people, providing the needed resource for them to implement what they need to implement. But we want to move away from that. We want to provide this fora, and we are hoping that the partners joining this morning will not just be here for this official opening, then move away. Yes, we know that they have engagements, but we think that they need to create time to actually listen in to what young people are saying. So that even as we go back to our boardrooms, to our offices where we make decisions, we can be able to reflect back on what the young people are demanding and are saying and believe works for them. So even as partners leave, if you can still remain engaged via the virtual platforms that we have provided, so you're able to listen in and we'll ensure to share the results of this particular gathering so that you can be able to reflect on it, even as we make decisions beyond this particular event, getting into next year, as you think about what works for the young people. So we think that that is very important. So to the young people gathered here today, I would like to encourage you to take this and use this opportunity to your advantage. Do not sit back, fold your arms, and just listen in. Use your voice. I think so many times, more often than not, young people complain of not being given an opportunity to engage. Like no one tells us, no one gives us a platform to engage. This is the platform. There are so many platforms you have organized where you have young people sitting, you give them an opportunity to speak. They start complaining about not being given an opportunity. We have not been given an opportunity in the past. Forget the past. Live in the now, right? So this is the opportunity. Let's grab it. Let's use it. Let's maximize and ensure that this event can actually yield the much needed result. So we'll be looking forward to getting from you what you are saying, and we'll continue to engage. So just a reminder, I've been told to remind those that haven't registered yet, please ensure that you register, because those registers will be used for so many things, including your transport refunds and the like. So if you're not there, you will not be counted. So just ensure, take that responsibility on your own to ensure that you do that. So at this point, sometimes I don't run out of talk time. So let me pause here and invite Ms. Nana Zulu to come and give her remarks on behalf of HIVOS. Nana Zulu.
Thank you, Sibu. Good morning, everyone. Good morning, everyone. That's much better. So may I recognize the presence of the Provincial Health Director, Dr. Mwale, representing the Minister of Health, UNAIDS Country Representative, Dr. Barry Huta, UNAIDS Representative, Mr. Remy Mukonka, and other UN agencies, National AIDS Council Director, Dr. Osborne, joining us virtually, ZYP National Coordinator, Mr. Malambo, representatives from the SADC Secretariat, representatives from the Ministry of Health, Ministry of Youth, Sport and Child Development, and other line ministries present, representatives from civil society, local and international delegates, young people, our adolescents, our leaders, and may I simply say, ladies and gentlemen. I am here representing HIVOS in general, but the regional SRHR fund in particular, who are collaborators and co-sponsors of this wonderful event. I would like to recognize our international delegates. Like Siwu said, this is an unprecedented time where it is so difficult to travel across borders. So we recognize that you could make time to come through. We also recognize those joining us virtually. With COVID-19, there's new ways of working. And so we are happy that we can still join in with other colleagues that may not be able to travel. This Indaba presents an opportunity for us to exchange knowledge. As a fund, we've been supporting partners across East and Southern Africa to be able to respond to adolescent health issues and to be able to provide them with grant opportunities where they would not normally compete with other larger organizations. So we're looking at organizations, community-based organizations, non-governmental organizations in Kenya, Malawi, Zimbabwe, and Zambia, but more recently spreading out to over 9 countries within the East and Southern Africa region to be able to support responses that are led by adolescents, responses that respond to adolescent health issues. So seeing a convening such as this one makes us proud because we are putting our values forward and we're bringing together young people front and center to be the people that are discussing issues that are affecting them, but more so the people that are developing solutions for the issues that surround them. This convening could not have come at a better time when we have the COVID-19 pandemic that is not only affecting how we relate as young people, how we discuss issues, but also has greatly affected adolescents' access to sexual and reproductive health information and services. So we are here to find solutions. Other than COVID-19, there are so many things that are happening within our countries that act as barriers or hinder adolescent access to information and services. This is our platform. This is our space to share those experiences. This is the place to come up with innovative and creative ideas of how we can address those barriers and challenges. We as partners are excited to hear from you because when we have resources to support partnership and collaboration, we want to ensure that you're at the fore and you are the ones that are coming up with these solutions. Like I have mentioned, that this is also a space of collaboration. We are happy that other partners such as SAT, AFRIAN, and others have come on board to be able to provide technical input in the areas that they are well vested and working across different sub-national and regional spaces. This space will also provide collaboration for us in terms of the sub-grantees that we have as a regional fund to collaborate and learn from each other. So I know in this space we might have very few international delegates, but I know that the breakout sessions would discuss very critical issues. Among them, the age of consent, that as adolescents, we want to be able to access information and services. What is the reality when we as the adolescents go to the health service provision points? What actually happens and how can we improve that service? What is the quality of the service? Is it adolescent friendly? Is it the kind of service that we want to be able to see? Other than that, there's issues of comprehensive sexuality education. Those in Zambia will remember that we have had calls for the CSC curriculum to be withdrawn. This is the platform for us to come up with solutions to that. How important is CSE for us as young people, for us in tertiary institutions, for us in schools? What does this mean for us as adolescents? So it's a clarion call, like the previous speakers have talked about, that for us, we're not here to tell you what works, but rather we want homegrown solutions from you, from the exchanges with other colleagues from other countries, so that when we are moving forward, we're moving forward with what actually matters to young people. So I wish you fruitful deliberations, and also as young people, do have fun when you are here. Thank you very much.
Thank you so much, ma'am. Thank you. Right away, I'll ask the USAID representative to come and give their remarks. UNAIDS. 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 Not the UN system, but the UNAIDS.
Thank you very much. I'm Dr. Tarsis Barihuta, UNA's country director, not USAID. But it's not the first time. We have some letters delivered both sides. The guest of honor, the Dr. Consisi Mwale Lusaka Provincial Health Director, representing Honorable Minister of Health, Dr. Chirufya, who is the guest of the honor. The coordinator Zambia Youth Platform, Sibu, and your team. The National AIDS Council Director General, Dr. Connie Osborne, Minister of the Eastern South Africa region, there are varied definitions of youth. Those terms can refer to varied age groups that are separately defined as young people or just youth. In Zambia, for example, youth include those that are up to the age of 35. There are over 2 billion young people in the world today, and 90% of whom are living in developing countries, including this region, where they tend to make up a large proportion of the population. Ladies and gentlemen, as we are gathering here today to have a frank conversation, I would like to share with you some reflection on key challenges when it comes to the well-being of young people that we may consider during our deliberation, and particularly if we want a sustained response, whether on HIV and SRH responses. We have to go beyond the HIV and SRH response, even go beyond the health. One, some reflection on health. Even though youth is in general the healthiest period of life, the international differences of mortality amongst youth are striking. In more developed regions, only 1% of the less of 15 years old die before the 20th birthday. But concurrently, the odds of dying during the youth are almost twice higher in South Asia and 4 times higher in Sub-Saharan Africa. Despite some regional variations, there is a commonality in the causes of adolescent of young people death worldwide. The causes of adolescent death include communicable diseases, HIV/AIDS, tuberculosis, and the lower respiratory tract infections, and also non-communicable diseases related to problem behaviors, motor vehicle fatalities, violence, self-harm, alcohol, tobacco, and other drugs, and risk sex leading to early or unattended pregnancies and child marriages. When we look at the marriage, data from demographic and health surveys conducted in 80 countries since 2005 indicate that in 23 of those countries, at least 10% of women aged 20 to 24 at the time of the interview had married before age of 15. This is unacceptable. We can't continue like that. Among those countries, 16 were in Africa, 5 were in Asia and the Pacific, and 2 were in Latin America and the Caribbean. Because contraceptive use is low among adolescent women, early initiation of sexuality activities, whether after marriage or before, is associated with high levels of adolescent fertility. Given the many challenges that young people face, particularly in Eastern and Southern Africa, the UN family is committed to ensure that the sexual reproductive health rights and adolescent and youth are upheld. The UN family has been encouraging and supporting governments in the development of adolescent health strategies, which are aimed at building knowledge and life skills among young people and ensuring access to HIV, AIDS, and SRHR services, and making adolescent health an integral part of the national health agenda. And you heard from our previous speaker that Zambia had one. Now is to make sure that we implement it and we make it sustainable. Coming to the COVID-19 impact, is very clear that, dear friends, the world is really in turmoil. Economies are in free fall. We have been brought to our knees by a microscopic virus, the novel coronavirus. The pandemic has demonstrated the fragility of our world. It has laid bare risks we have ignored for decades. Adequate health systems, gaps in social protections, structural inequalities, environmental degradation, and the climate crisis. Anti-regions that were making progress on eradicating poverty and narrowing inequality have been set back years in a matter of months. The coronavirus, just like HIV, poses the greatest and varied we live in a post-racist world is not true. The myth that we are all in the same boat. Because while we are all floating on the same sea, which is our world, it's clear that some are in ships while others are clinging to the floating debris. Even the availability of the vaccines is being determined by the ability to pay. UN globally is advocating, pushing strongly that for COVID-19 vaccine became available for all around the world, starting for those who are most vulnerable. And we think strongly that we'll make it. Inequalities defines, unfortunately, our time. More than 70% of the world's people are living with rising income and wealth inequality. The 26 richest people, only 26 people in the world, hold as much as wealth as the half of the global population. But income, pay, and wealth are not the only measures of inequality. People's chances in life depend on their gender, family and ethnic background, race, whether or not they have a disability or other factors. Multiple inequalities intersect and reinforce each other across the generations. The lives and expectations of millions of young people are largely determined by their circumstances at birth. In this way, inequality works against human development for everyone. We all suffer its consequences, and we have seen that COVID had demonstrated whether you live in the richest family, whether you live in the richest country, you are also vulnerable. This is important to understand that we have the duty to be so with all the people to move together if you want a better humanity. Even when we talk about prevention of HIV infection and other sexual and reproductive health injustices, we are not on the same level. Some have better access to knowledge and services, while others are left behind. High levels of inequality are associated with economic instability, corruption, financial crisis, increased crime, and poor physical and mental health, and debilitating unemployment, particularly among the young people. Discrimination, abuse of the lack of access to justice define inequality for many, particularly street-involved young people, migrants, refugees, and minorities of all kinds. Such inequalities are a direct assault on human rights. Addressing inequality has therefore been a driving force throughout history for social justice, health rights, labor rights, and gender equality. The vision and promise of the United Nations is that food, healthcare, water and sanitation, education, decent work, and social security are not commodities for sale to those who can afford them, but basic human rights to which we are all entitled. We work to reduce inequality every day, everywhere. In developing and developed countries alike, we systematically pursue and support policies to change the power dynamics that underpin inequality at the individual, social, and global level. And that vision is as important today as it was 75 years ago when United Nations was created. It is at the heart of the 2030 Agenda for Sustainable Development, our agreed blueprint for peace and prosperity on a healthy planet, and captured in SDG 10, reduce inequality within and between countries. Dear young people, dear friends, even before the COVID-19 pandemic, many people around the globe understood that inequality was undermining their life chances and opportunities. They saw a world out of balance. The anger feeding two recent social movements reflect out disillusionment within the status quo. Women everywhere have called time on one of the most egregious examples of gender inequality: violence perpetrated by powerful men against women who are simply trying to do their jobs. And the anti-racism movement that has spread from the United States around the world in the aftermath of George Floyd killing is one more sign that people have had enough. Enough of inequality and discrimination that treats people as criminals on the basis of their skin color. Enough of structural racism and systematic injustice that deny people their fundamental human right. And let us not forget another great source of inequality in our region, in the world at large. We live in a male-dominant world with a male-dominant culture. Everywhere, women are worse off than men, simply because they are women. Inequality and discrimination are the norm. Violence against women, including femicide, is at a becoming levels. And this again unacceptable. Gender inequality harms everyone because it prevents us from benefiting from the intelligence and experience of all of humanity. Young people can bring these global scourge of violence against women and girls, and you can make a difference. This world will change if you commit yourself to change that narrative. There is a new generation of inequalities that goes beyond income and wealth to encompass the knowledge and skills needed to succeed in today's world. Deep disparities begin before birth and define lives and early deaths. Dear friends, looking to the future, two seismic shifts will shape the 21st century: the climate crisis and the digital transformation. Both could widen inequalities even further. The digital divide reinforces social and economic divides, from literacy to healthcare, from urban to rural, from kindergarten to college. In 2019, some 87% of people in developed countries use the internet, compared with only 19% in the less developed countries. You can see where we are now. And if we don't correct those danger trends, it will be very hard for us. We are in danger of two-speed world. Political leaders must raise their ambition. Business must raise their sights. And young people everywhere must raise their voices. There is a better way, and we must take it. But populism, nationalism, extremism, racism, and scapegoating will only create new inequalities and divisions within and between communities, between countries, between ethnicities, and between religions. Dear friend, HIV, AIDS, and COVID-19 are human tragedies, but they have also created a generational opportunity, an opportunity to build back a more equal and a sustainable world. A new social contract will enable young people to live in dignity, will assure women who have the same prospects and opportunities as men, and will protect the sick, the vulnerable, and the minorities of all the kinds. The 2030 Agenda for Sustainable Development and the Paris Agreement show the way forward. The 17 Sustainable Development Goals address precisely the failures that are being exposed and exploited by the pandemics. Education and digital technology must be two great enablers and equalizers. Governments must prioritize equal access from early learning and lifelong education. Neuroscience tells us that preschool education changed the life of individuals and brings enormous benefits to communities and societies. So when the richest children are 7 times more likely than the poorest to attend preschool, it's not surprised that inequality became intergenerational. And as technology transforms our world, learning facts and skills is not enough. Government needs to prioritize investment in digital literacy and infrastructure. The digital revolution and artificial intelligence will change the nature of work and the relationship between work, leisure, and other activities, some of which we cannot even imagine today. Dear friends, growing gaps in trust between institutions and leaders threaten us all. Young people want social and economic systems that work for everyone. They want their human rights and fundamental freedoms to be respected. They want a say in decisions that affect their lives. This movement rejects inequality and division and unites young people, civil society, the private sector, cities, regions, and other behind policies for peace, justice, and human rights for all. It's already making a difference. To achieve the Sustainable Development Goal number 3, health and well-being, where HIV and SRH is addressed, which is to ensure healthy lives and promote well-being for all persons of all ages, young people must also be assured of universal access to sexual and reproductive health care. And we have a very, very important role to play in that goal. The AIDS response has delivered more than results. It has delivered the aspiration and the practical foundation, including the medical advancement, intervention, and partnership to end the epidemic by 2030. And we have all the means. We have all the tools for prevention. We have all the tools for treatment. There is no reason we can't end HIV/AIDS as a pandemic by 2030. We are at a unique moment in history. The remarkable progress in the AIDS response has represented the world with the fragile window of opportunity to end the AIDS epidemic as a public health threat. Zambia is one of the 7 countries which have been able to reach the 1990 UN's fast track target. We should be proud of it. and we should applaud this great achievement. Is your achievement. And this will protect the future of the country, will protect the young people. But here there is a but, and this is where you have to play a key role. But the new HIV infections remain very high, as from 2010 until 2019, we have only reduced the new infections by only 10%, instead of 75% projected in the National Strategic Framework on HIV. Young people are more affected when you look at the tendency. I think we'll discuss later on that when the presenters will be done. And young people, you can make a difference to accelerate the reduction of new infections if you are empowered. And we must empower you to give all the means to reduce the new infections. I'm confident that after the 2 days conference, the young people movement in these Eastern and South Africa countries will come with clear recommendation to inform the roadmap that will help us to accelerate the access to HIV SRH services for all. And I thank you.
Thank you so much. We can put our hands together. We can do much better. We can do much better than that. Gatwacha mchechi gatwachunda ati kambi amaboko 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 amaboko. Thank you, sir. Thank you so much. One thing to take from there, young people, let's take a lead. Young people, let's take a lead. It's time and the season for the young people to take a lead and to be the change we want to see. We've been speaking for so many years, but one of the things we need to do is take the lead and be the change we want to see. Allow me at this moment to call the National AIDS Council Director, I believe. Okay, she's joining us virtually. Can we put our hands together for her?
Presenting this honor, Honorable Title. My connection is not very. You can hear me? Okay, thank you. The chairperson of the Zambia Youth Club, Mr. Steve Malabo, the PEPFAR country coordinator, Ms. Daphne Williams, the UN You only start people come to us 250. And then we increase it to 350. And then after that, it was like 500. Today, it doesn't matter what the people count is. As soon as you have your activity positive, you have to start contributing. I therefore would like to elaborate on the test and treat policy, which has been another game changer. We are now in the and we are realizing that we cannot treat ourselves out of
Thank you so much. Allow me to also recognize one of our partners, SAT, the country director, Miss Lengani Nanyangwe. Yes. So can we put our hands for her, please? Ma'am, you are welcome. You are welcome. Okay. Can you just greet your neighbor? You look serious. Am I having young people in here? Do we have young people in here? I can't hear. You're too quiet. Do I have young people in here? Okay, give a high five. Okay, no, Corona. Okay, allow me to welcome the ZYP board chairperson, Mr. Oscar, who will give his remarks and in turn call our guest of honor. Thank you, sir.
Thank you very much. The guest of honor represented by the Provincial Health Director, the National AIDS Council Director, the UN AIDS representative, the SAT Country Director, the SADC Secretariat, HIVOS representative, and distinguished ladies and gentlemen. I'd like to make an apology. I'm a Lozi by tribe, and as Lozis, we are not very good at mentioning names, so I couldn't mention names. I've got 3 assignments as I stand in front here. The first one is to make you put a smile on your face. It's a youth engagement function, and we should not have very closed faces. We should have open faces and excited. I'm so happy with the gentleman that came first to pray. He was asked to pray, and he prayed in his mother tongue, which was so impressive. He just reminded me of a situation. Yesterday, I was at the Choma railway station, and there was a Tonga man and a Bemba man there standing together. They were waiting for the train. And when the train approached, the Tonga man shouted and said, "Jabola jitima jabola." And the Bemba man said, "Inga chabola tawachinine." And then the Tonga man said, "Well, naiwe wachinina taukochitanta." But to our international delegates, I would just like to mention to you that we like our mother tongues. We are proud of our mother tongues. I just used our local language. So that was my first assignment. My second assignment is to repeat what our executive director, Zambian Youth Platform, Siwu Malambo, said, that he is the executive director, he's not the chairperson. He made that very clear. So the board has been sending me texts and saying, "Has the executive director gotten your job?" I said, "No, he has not." He actually said he is the executive director. My third assignment is to look at the theme. It's advancing prevention through sustainable solutions, led by adolescents and young people. I want to make mention to you that leadership began when you saw the advert and you applied. Leadership continued when you got a ticket and got on a bus and came to this place. Leadership continues when you participate in this event. So don't be dormant, participate as much as you can, because now as young people, we have a table, we have a chair on the table. In other instances, we were never given a chair on the table rather, but now we have it. And what are we gonna do with it? Let's express as much as we can express. Let's gather as much as we can gather, and let's be free. Let's enjoy ourselves. Let's share our best practices, so that by the end of the day, the outcome of this event will be something that we'll remember for years to come. Because it's in this global pandemic that we've been able to gather in this manner, all provinces from Zambia and a few delegates from around the region. That is not easy. It's not been easy. But because it has happened, we cannot take for granted such an opportunity. I'm a reverend by calling, and I'll say amen. Forgive me for those that may not like that. I'll go straight to my third assignment. My third assignment is to invite, it's an honor to call upon the provincial health director who is representing the guest of honor to give us a speech and officially open our function. I invite you to be upstanding at this point as we invite the guest of honor rep to the podium to open officially. Let's give a hand.
Thank you. We may take our seats. Are we all happy to be here as we sit? That's a week, yes. Is that a sign that we need to take our morning break? Are we all happy to be here? Better. Thanks. Allow me to, first and foremost, send sincere apologies from the guest of honor, the Honorable Minister of Health, Dr. Chitalu Chilufya, who would have loved to be here, but unfortunately, due to a crash in programming, he had to attend to other equally important duties. Not that this is not important, and as such, I will read the remarks on his behalf. I recognize the participation physically and virtually of the following the PEPFAR country coordinator, Madam Duffy Williams, the UN AIDS country director, Dr. Barry Hatter, the National AIDS Council director, Dr. Connie Osborne, the representative from HIVOS, the ZYP chairperson, representatives from Ministry of Health, all the youth present physically and virtually, may I simply say, ladies and gentlemen. All the young people from the Eastern and Southern Africa, I am indeed very happy to join you at this very important and well-attended physical and virtual event, the Regional Adolescent Health Indaba. And special gratitude goes to the board and management at the Zambian Youth Platform, ZYP, and all their strategic partners are Trust Zambia, HIVOS, Afrianansa, UNAIDS, National AIDS Council, for putting this occasion together successfully. I have learned that this is a regional event, so allow me to warmly welcome all our international delegates, and if they could just stand and wave. Thank you for coming. We appreciate your participation. My government fully supports engagements such as this one with clear-cut objectives, especially complementing government's effort in rising in public health, health promotion practices, and social behavior change among adolescents and young people. my government takes this opportunity to learn how you adolescents and young people intend to lead the process of advancing prevention through sustainable solutions. Adolescence is known to many as a time of opportunity, but also one of risk. It presents a window of opportunity because actions could be taken during this period to set the stage for health adulthood and to reduce the likelihood of problems in the years that lie ahead, such as prevention of cardiovascular diseases, of adult through the development of healthy diet and exercising habits. At the same time, it is a period of risk, a period when health problems that have serious immediate consequences can and do occur, such as death resulting from road traffic accidents and sexually transmitted infections and unwanted pregnancies resulting from unprotected sexual activity. A period when behavior problems which could have serious adverse effects on health in the future, such as tobacco smoking and alcohol consumption, are initiated. For this reason, I do not have even the slightest speck of doubt in my mind that this regional adolescent Indaba will deliver on its core objective because the delegates comprise of adolescents and young people, as well as key stakeholders who have expertise and experience in advocacy, gender, masculinities, adolescent health programming, male engagement, community-led monitoring, sexual and reproductive health and rights, and HIV. For this composition, give yourselves a round of applause. I'm further advised that this regional adolescent Indaba endeavors to share existing best practices among participating countries in the SADC region to support scale-up. It is envisaged that this will improve sexual and reproductive health practices and HIV-related service delivery for adolescents and young people, especially boys and young men in all their diversity. It will also help us to generate the African Youth Platform commitment to support achievement of the globally agreed fast-track goals. Transform harmful gender norms and will also improve HIV outcomes for young men and boys, as well as adolescent girls and young women, among other things. In 1995, the World Health Organization, in conjunction with the United Nations Children's Fund and the United Nations Population Fund, agreed health and development. That common agenda had the twin goals of promoting healthy development in adolescents and the prevention of and response to health problems if and when they arise. It called for the implementation of a package of interventions tailored to meet the special needs and problems of adolescents, which includes the provision of information and skills, the creation of a safe and supportive environment, and the provision of health. Adolescent health is at the epicenter of the Ministry of Health The delivery of adolescent health has a very special place in the core mandate of my ministry, as has been shown in the many deliberate policy frameworks and strategic regional and international protocols running side by side. There cannot be healthy nations without an effective adolescent health response. According to the Adolescent Health Situation Analysis, the main problems facing adolescents and young people include such as malaria, HIV and AIDS, and STIs, and nutrition, early and unprotected sex, sexual abuse, early marriages and pregnancies, drugs and alcohol abuse, unsafe cultural practices, mental health problems. In order to meet these diverse needs, the Adolescent Health Strategy proposes that adolescents require holistic, appropriate, and comprehensive packages of adolescent-friendly health services focused at addressing their special health needs and reducing barriers to accessing health services. Currently, the Ministry of Health and its stakeholders is working on repackaging appropriate adolescent health services. However, a number of youth-friendly corners have been established to provide youth-friendly health services. However, the services offered by youth-friendly corners are targeted at the youth, which is a much broader target group, representing different age groups with varying health needs. As such, it can be observed that currently there are no public health facilities offering specific healthcare packages targeting the adolescents and their special needs, and this is being addressed. Under these circumstances, adolescents have two options available to them in respect of accessing health services, namely either accessing health services through the youth-friendly corners where such services exist, or accessing the standard health services offered to the general public. Moreover, governments have been the world over working on guaranteeing effective adolescent health services in many ways, but not limited to the following. And this is happening in our country as well. The work begins with redefining and broadening the package of adolescent-friendly health services, and by so doing, develop and update national guidelines and standards for adolescent-friendly health services, improve the procedures for easy access, develop and implement incentives for encouraging access, scale out adolescent-friendly health services to all districts and facilities in our country, strengthen community, particularly youth involvement and participation in planning, organizing, implementation, and monitoring and evaluation of adolescent-friendly health services. strengthening linkages, networking, and partnerships. Furthermore, my government shall continue to prioritize funding of adolescent health services through the Ministry of Health and its partners by advocating for more partner participation and technical support to the adolescent health program, strengthen budget tracking in respect of adolescent health funds in order to ensure that the funds provided are utilized on the intended activities, as well as promoting private sector participation and support. A quick glance at the agenda and program tells me that this